Hi, so today we're going to be going over some of the details of the structures of the respiratory system. We're going to start by looking at the overall structure. We'll just sort of talk about things as a whole, the conducting passages, respiratory passages, and then some of the structures of the lungs. And then we'll get into the anatomical details, going into some more detailed drawings about exactly what's going on at different places down along the path and why they're arranged the way they are. So let's start by talking about sort of the overall arrangement. I'm just going to do a really quick sketch here. It's going to be terrible. Okay, now let's go with that. So, when we start by talking about the respiratory system, we're going to start with the conducting passages. These conducting passages are the ones that just bring air in from the outside and prepare it for the respiratory passages which come later on. So those conducting passages are the nasal cavity, which is up here, the pharynx, and the larynx here, also known as the voice box, that cartilaginous thing right here that buzzes when you make sound. The trachea comes down into the chest from the larynx and splits off into the bronchi, one of which goes to each lung. Which split off into smaller bronchi and so on. Those then become the lungs. So the bronchi then split into tiny bronchioles. We're going to talk about the details of all of these. So all of these form the conducting passages. Their job is to bring air in, to warm it up, to humidify it, and to clean it, so that by the time it gets deep into the lungs, onto the respiratory passages, it's at 100% humidity, body temperature, and as clean as we can make it, with as little particulates and mold and bacteria and all the other stuff that's in the air. One other term we sometimes use here is that all of this part, down to the larynx, we would call the upper respiratory tract. And the rest of this, we would often call the lower. So really the upper respiratory tract is all of this stuff. And then the lower is up to there. Pretty much the larynx is the dividing point between them. So once we get past the conducting passages, then, I'll take a moment so you can take a look at that. Okay. Then we're down into the respiratory passages. These respiratory passages are the ones where gases are actually exchanged, where we move oxygen from the air into the blood and CO2 from the blood into the air, and other gases back and forth too, although oxygen and CO2 are the ones we care about. Those would include respiratory bronchioles and alveoli. The respiratory bronchioles are some of the smallest of the bronchioles. We'll talk about that a little bit when we get to that part in the details. But the alveoli are the tiny little air sacs that fill most of the lungs. There are millions of these, so I can't draw them. I'm just going to draw kind of vaguely squiggly lines to represent the alveoli. That's most of the exchange surface. We talked in the first part of the respiratory system about the idea of exchange surface, where we have a thin layer of blood separated from air by a thin, moist membrane. that allows gas exchange. The alveoli and the respiratory bronchioles are that exchange surface, mostly the alveoli. And we're talking about, like you said, about 70 square meters of respiratory surface in there. So that's rather a lot. So we've got the conducting passages and the respiratory passages. The other part of the respiratory system that we may want to talk about a little bit are sort of the accessory structures. These are the structures that help us to move the air around. So here we'd be talking about things like the pleural membranes that surround the lungs. So things like the pleura. There's actually two of them, an inner and an outer pleura, visceral and parietal, but we'll talk about that in a little bit later in the details when we talk about ventilation. And then the muscles. Oops. So muscles like the diaphragm, which is a sheet of skeletal muscle here along the bottom that's involved in helping the lungs to expand so we can breathe, and other muscles like the scalenes and sternocleidomastoids and the intercostals. I'll just say other muscles here, because we're going to be talking about those in more detail in a later lecture. So those are the structures that actually help us to cause the lungs to expand, to allow us to bring air in, and then to contract so that the air can come out of the lungs. So that's sort of the overview. The whole goal is to bring air in, clean it, warm it up to body temperature, and bring it up to 100% humidity, so that by the time it gets to the respiratory surfaces, it's prepared and we can exchange gases properly. That's the job of these two passages. The accessory structures are what lets us get that air to move, to force pressure changes that make the air move around. So that's the overview. In this next part, we're going to be talking about some of the anatomical details. Okay, let's start our discussion here of the details. This is meant to be a cross-section of a head. So the idea is that this is the nose up here, this is the mouth, chin, and neck. This is the back of the head, forget what happened there. Anyway, so we're going to start by looking at where the air comes in, here at the nostrils. So air normally comes into the body through the nostrils, through the nose, and normally that's only for air. If you're putting anything else in your nostrils, you're probably doing it wrong. But anyway, the nostrils, we usually have a little bit of hair in this area. That hair is primarily to help kind of provide a very coarse filter and keep insects and very large things out of your nose. That leads then into this nasal cavity. Which is it's a surprisingly large, although fairly narrow space. It doesn't take up much room side to side, but it actually goes up quite a ways into your head. The brain is just sitting right up here. In fact, the olfactory bulb sits just above this over a thing called the cribriform plate, where neurons from the olfactory bulb come down through and dendrites are embedded in the nasal mucus. That's how we smell, that molecules from the air dissolve into that mucus and get picked up by those dendrites. Anyway, this nasal cavity is lined with a rich, well-vascularized mucus epithelium. That mucus epithelium is full of goblet cells, which are cells which provide, they secrete mucus into the nasal cavity. That mucus adds humidity. It also traps contaminants. And all of the blood vessels in this area add heat. So as the air comes through here, it gets warmed, humidified, and cleaned. There are 3 folds of bone in here as well. The nasal conchae, that have more of that epithelium on them, that just increases the amount of surface area in here. So there's more of that epithelium to warm, clean, and humidify the air. All of the blood vessels in there are one of the reasons why if you get damage to this area, you tend to get a nosebleed, because there's lots of blood vessels here, so if there's bleeding, it's easy for it to come out the nose. Okay, now back here at the back of the nose, we have an area called the nasopharynx. Which comes down into this area called the oropharynx. And you'll notice here that the oropharynx meets up with the mouth. So this is the oral cavity. And this here, this pink thing, is the tongue. So the passageway for air here and the passageway for food share a common area, the oropharynx. That's good in many ways for humans. That the fact that you can breathe through your mouth is actually a benefit. People will sometimes say, don't breathe through your mouth isn't meant for air, it doesn't prepare the air as well. And it's true that the nasal cavity is better at warming, cleaning, and humidifying the air. But nothing terrible is going to happen to you if you bring air in through your mouth. In fact, it's really good that we can. If you have ever had any sort of allergies or anything like that, you know that this area can sometimes get plugged up with mucus. And if that gets plugged up and we don't have any other way to get air in, well, we suffocate and die. So the fact that allergies are not inherently fatal because you don't die every time your nose gets closed up, you can thank the fact that you can also breathe through your mouth. That is not the case in all mammals, if I understand correctly. If I think that whales have a completely separate respiratory and food passage. So unfortunately, that scene in Finding Nemo where they get swallowed and then blown out the blowhole, as far as I know, not anatomically possible. But in any case, what we don't usually want is for these things to mix. For example, if you swallow food, you don't want the food to get shoved up into your nasal cavity. Generally, you don't want food up here. It hurts. One of the most painful things I have experienced was accidentally snorting some butter salt up my nose, and that really, really hurt as it hurt this. Now, why I was snorting butter salt, that's a different story. But anyway, so back here, kind of dangling down from what we call the soft palate, this flexible bit of tissue here, is this little structure called the uvula. The dangly bit, the little punching bag thing at the back of your throat. And when you swallow, the uvula's job is to swing up here and block the nasopharynx so that food coming down through here does not go up your nose. So that's what it's for. I would show you on me, except I actually don't have a uvula. This is kind of an interesting thing. When I was in college, I had surgery for sleep apnea. You may be familiar with sleep apnea. It's a condition where during the night you stop breathing. Anyway, so I had surgery to reshape the back of my throat. They changed my soft palate, took out my tonsils, and removed my uvula so that it would stop blocking airflow at night when my throat relaxed. So, sorry, I can't show you mine. Anyway. Oh, and I guess the question then comes up, well, does food then go up my nose? And apparently, if you have a good surgeon, and I was lucky enough to have one, then no, they can do this to where the food doesn't go up your nose even though you don't have a uvula. However, my understanding is some people do not get so lucky, so I was very fortunate on that. Anyway, so back to this. This oropharynx area is used by both food coming in and air coming in. So we come down here with both food and air, and then we have a choice. We have two passageways we can go down. Down this way is the esophagus. That's for food. That leads to the stomach. While there's not usually anything terrible that happens if air goes down that way, it's also not what you want. Unless, of course, you have trained yourself to burp on command, in which case what you're doing is forcing air down this and then letting it out as a burp, which I never learned to do. I was very sad about that. Anyway, so when we want food to come in here, we want food to come down and then go down the esophagus. But air coming in through the nasal cavity, we want that to go down this passageway into this structure here, which is called the larynx. And then down below that into the trachea. So the question is, how do I make sure things go the right way? Because air going into the esophagus is not so terrible, but air going down this way is not so bad, but food going down into the larynx is a serious problem, because the larynx is very narrow. And if food ends up going down here, it often gets stuck and blocks the air passage. This is the only way for air to get to and from your lungs. So if food blocks this, then you choke, and that's a big problem. So how is it that when we're swallowing, we try to make sure that food doesn't go down here? Well, this structure right here, this little flap, is the epiglottis. And when we swallow, two things happen. This area comes up, and the epiglottis swings down so that it acts like a little lid, covering the larynx, so that food, when this epiglottis swings down like this, food just slides down over the epiglottis and down to the stomach. And then when we breathe, we open up the epiglottis. So choking often happens if you've got food in your mouth and you're getting ready to swallow it, and then suddenly something surprises you, or you laugh and you take a deep breath. And when you breathe, this opens up. But not only that, when you breathe in, air gets sucked down this way. So if you've got food in here, it goes and gets sucked into the larynx. So try not to laugh or take sudden inhalations while you're swallowing. Try to separate those two. Anyway, another interesting thing up in here while we're still in the upper respiratory tract is here in the larynx. This is the structure where you've got the vocal folds. These vocal folds are thin membranes covered with an epithelium that are stretched out over the air passage. So if we were to take a cross section here, they would look something like this while you're breathing, and this while you are speaking. So these vocal folds get pulled over the air passage so that as air is coming up through them, they vibrate. And that vibration is what produces the sound. So that when you are making sounds, you force air up through the larynx here by exhalation, but you stretch the vocal folds out over the airflow so they vibrate, and the vibrating air comes out here and you make sound. This larynx is also surrounded by a lot of cartilage, which also helps to resonate and vibrate along with this, which changes the sound. Also, the sound resonates up here in the nasal cavity and in the sinuses up in this area, all of which goes to shape the characteristics of the human voice. Then humans, in addition to having these sounds, we further shape that airstream with the tongue, lips, teeth, and everything in here to make complex patterns, which come out as words, language, singing, whatever. But we can make very complicated shapes in the air. Now, the larynx matures with age, and when both males and females, or when everyone is young, they have thin, tightly stretched vocal folds and not a lot of cartilage here, which means that you produce high-frequency vibrations and have a high voice. But with puberty, both sexes, but males even more so, thicken the vocal folds and add more cartilage, which causes them to vibrate more slowly, so that especially males have lower voices after puberty. Now, there's an interesting story with that, too, about the idea of the castrato. That if anybody's into vocal music, you know that boy sopranos, that young male singers, have this kind of a unique high voice. And somebody back, we're talking here back in, I believe, the 1600s and early 1700s, had this idea that, wouldn't it be nice if we had singers that had the vocal power of an adult male, the lung power of an adult male, so they could support a lot of volume, but the high voice of a boy soprano. And they decided, I know what we'll do. We'll take promising boy sopranos and cut off their testicles so that they don't go through puberty. And that's exactly what they did, which produced a unique voice type called a castrato, which was a man who'd been castrated before puberty so that their voice would stay high. These were sort of vocal superstars of their day. Now, of course, at some point someone said, this is really not a good thing to do. We probably should not be castrating promising young male singers. That's not very nice. So the practice was outlawed. I believe, I'll have to look it up. But for a little while there were a surprising number of accidents in, for example, orphanages. If you had promising young male singers, oh gosh, too bad, something happened, a cow stepped on his testicles and crushed them. Hopefully he can find a career in the opera. Anyway, so we don't do that anymore, but thankfully. Anyway, so all of this was the upper respiratory tract. Once we get past that, we're going to be heading down in here into the lower respiratory tract. So let's do a new sketch for that.